Who is pelvic therapy actually for? Hello, I'm Dr. Kaylee Simmerman. I'm the owner and founder of the Hope Doctors Pelvic Floor Therapy here in St. Petersburg. Best pelvic therapy in the burg. Anyways, shameless plug, but I'm going to be talking today about who is pelvic therapy actually for. Welcome to my car. I drive a lot for work. Sometimes I stop at random parking lots to record these videos. It's just life of a mom entrepreneur. But yes, so the question came up this week specifically where it was just like, oh, I didn't know that you treated this. I didn't know that you could treat this population. I didn't recognize that this was something I could go to pelvic therapy for. And let me just go ahead and start off from the bat. I understand that the most common population is known to be a person who has had a baby, and that is the person that typically will reach out for pelvic floor therapy, or that we know will go to pelvic floor therapy. And yes, that is the most common population, but that's not the only population. One of the biggest populations that we see at the Hope Doctors is actually the prenatal population. So we see clients all through their pregnancy, because we love it and because there's so much that we can help with. During pregnancy, pelvic floor therapy can really benefit to prevent back pain, sciatica, round ligament pain, pubic bone discomforts. We can really help with the rib cage discomfort. We can keep you breathing. We can continue core exercise, because I don't care what anybody says, core activation, core exercise is very important during pregnancy. You should still exercise during pregnancy unless there's a reason for bed rest or pelvic rest. But yes, we help you exercise during pregnancy. If you are an avid athlete, we can help you do that all the way up until birth, if that's the plan. We can be a part of your birth team, where we're really helping to prepare the pelvis, prepare your body, do the best that we can to give you the best experience that you can, which is super, super fun. We love treating our prenatal population. Another population, the Hope Doctors currently, we don't have this population or a specialist here, because let me be clear, pediatrics specifically for kiddos is a different specialty. You can't go to a pelvic floor therapist who has had no extra training in pediatrics and think that they know what they're doing. They are just marketing to you. Make sure and ask, what other credentials, what classes, what coursework have you had? And if they say it's just because they understand the pelvic floor, that's false. Again, the Hope Doctors, we don't have a pediatric specialist right now. I'm hoping to bring it on in the future. But for pediatrics, there are pelvic floor specialists that work with constipation, bedwetting, helping you with potty training, all of those kinds of symptoms, diastasis recti, or separation of the core muscles when you have a child. That's a different subset of population that can also be worked with. There is the young group. So we start at 18 and up for legal purposes, but also because it's considered an adult, right? However, if you wanted a pediatric pelvic therapist, they can work with the clients who have their period first off, and those first few periods and those first few years. We typically will see them in their adult years. Hoping to find a pediatric specialist soon. If you are one and a pelvic therapist, please reach out. Anyways, and then we're going to move over to the male population, or the penis owner population. So these clients are the ones that are coming to us for erectile dysfunction, testicular pain, prostate issues, or they've just had their prostate removed. They're having severe constipation, diastasis recti, also very fit, very active, but possibly have diastasis recti, or they have weakness somewhere and they're not really sure why, or low back pain, hip pain that hasn't been helped with traditional physical therapy, chiropractic, all of that kind of stuff. So the male population is another big population. We actually do have a male pelvic floor specialist at the Hope Doctors. Her name's Dr. Joe. She's incredible. She actually loves the male population. It's been really amazing to see the beautiful work that she does with them. So that's really cool. We also do perimenopause, menopause. So we work with clients in that realm to know what resources to look out for. We help you understand your hormone panels. We help you put estrogen cream on properly, ditch the applicator. There's different ways that we can help you do that and understand that. And also, again, I'm the expert in Tampa Bay with prolapse, and so I can help you get fitted for a pessary if you have a prolapse that's getting worse later on in life. People that have never had kids, so people that are having endometriosis, interstitial cystitis, PCOS, or don't want kids, but they're having period pain, pain with intimacy, we can absolutely still treat you. You do not have to have been pregnant or have had a baby. We see a lot of clients, unfortunately, through loss as well, or through IVF, all kinds of different phases of life in order to help support your pelvic floor, because when we're trying to conceive, any restriction or anything on the outside that can contribute to those struggles, we want to make sure we address those too, because you deserve that. And so keep that in mind as well as a population. So ultimately, we can really, I always tell people, like, if you poop, if you pee, or if you procreate, which everybody poops and pees at least, we can help you, right? Like, pelvic floor therapy is out there for you. The biggest subset specialty, like, and again, I think it's important that you call and ask. So if you're a male, do you have anyone that specializes in male pelvic health? Have they taken extra coursework? The same thing with perimenopause, menopause. Is there any extra training there that you understand this phase of life better? With us, we have that, right? Same with prolapse. Hypermobility, Ehlers-Danlos. That's a new one that we're getting so many referrals for, which I'm so grateful for, because I suffer with that myself. Definitely a different type of a subset, different type of requirements, different type of education, different types of movements and understanding in that phase of life, right? And like in that diagnosis. Call the people, search for them, make sure that they have that specialty, make sure that they understand exactly what's going on in that phase of life. Here at the Hope Doctors, we work with anyone through your phase of life. We don't take we don't take insurance, so of course keep that in mind. However, we can help you understand things from all over the world, right? Like, we can coach you, we can guide you, help you find resources. So be sure to reach out if you feel like we are the right choice for you, because we truly care about you. Clinical excellence is very important for me and my practitioners. We do our continuing education and a lot more, and we make sure that we are prepared for those questions that you're going to have, those concerns that you're going to have, and we make sure that we are truly marketing to the right subset of people, but that we're prepared to work with you through pregnancy, through perimenopause and menopause, through being a male, like those kinds of things. And so keep that in mind. Let us know if you have any questions, but the main moral of today's video is just, you don't have to have been pregnant or have had a baby in order to benefit from pelvic floor therapy.